afternoon, and thank you for joining us for today's COVID-19 media briefing. It's being aired live on YouTube. Joining us today are DHS Secretary-Designee Karen Timberlake, Dr. Ryan Westergaard, Chief Medical Officer in the Bureau of Communicable Diseases, and Dr. William Melms, Chief Medical Officer at Marshfield Clinic Health System. And we begin today with remarks from Secretary-Designee Timberlake.
Good afternoon, and thank you for joining us today. We'd like to start today's briefing by going over the latest COVID-19 data and trends. Today we are reporting our 7-day average of new confirmed cases is 3,294. This is nearly double where we were only 2 months ago. Laboratories in Wisconsin have detected 19 confirmed cases of the Omicron variant through whole genome sequencing. This means that Omicron is here and spreading in Wisconsin. We are sad to report our total confirmed deaths have now reached 9,638. Our thoughts continue to go out to the families and friends who have lost someone to this disease. Again, we are seeing daily case numbers that we haven't seen since the end of last year. High rates of COVID-19 transmission are occurring in all Wisconsin counties, and that trajectory is growing. Our healthcare systems continue to be under tremendous pressure. Statewide, 96% of intensive care beds and 98% of intermediate care beds are currently in use. As of December 17th, our partners at the Wisconsin Hospital Association reported that there are 1,664 Wisconsinites hospitalized with COVID-19, 423 of them in intensive care units. That is an increase of 30 patients in 1 week and 258 patients since the beginning of December. We are at another critical moment in this pandemic. The highly contagious Omicron variant of COVID-19 has been detected and is anticipated to cause a rapid increase in disease activity in our state in the coming weeks, just as it has in other states and other countries. That is why the Department of Health Services has issued a public health advisory today, calling on all Wisconsinites to take urgent action to prevent additional hospitalizations and deaths due to COVID-19. This advisory is urging all Wisconsinites to take the following actions immediately to slow the spread of the Omicron variant. Get vaccinated against COVID-19, including getting a booster dose as soon as you are eligible. You can visit vaccines.gov or call 211 to find a vaccine provider near you. Wear a well-fitting mask in indoor spaces when you are with people that you do not live with. And celebrate safely over the coming holidays by keeping gatherings small, getting tested before visiting others, and staying home if you have any symptoms. In short, we ask every person across our state to renew their commitment to protecting themselves from getting COVID-19 by taking these steps. What each of us chooses to do in the next few weeks really matters. There is a serious risk that continued increased numbers of COVID-19 cases will overwhelm an already strained healthcare system. An even larger number of new COVID-19 cases will lead to more COVID-19 hospitalizations. As we will hear from Dr. Melms in just a minute, hospitals across our state are full, and our doctors, nurses, and healthcare providers are sounding the alarm. It continues to be the case that we have the tools available to turn back the pandemic. We just need to use them. By taking the simple steps noted above, we can prevent dangerous situations where patients experiencing medical emergencies may not be able to receive immediate, adequate, life-saving attention and care due to a lack of hospital capacity. As we have throughout the pandemic, we have to follow the facts and adjust accordingly. Delta, Omicron, and seasonal influenza are all serious threats to all of us because of the threat that they pose to capacity in our healthcare systems. We all have a stake in making sure hospitals can care for people who need them. By working together, we can celebrate the holidays safely, prevent more cases of COVID-19 and the flu, and in turn, prevent more hospitalizations and more deaths. I will now turn things over to Dr. Melms, who can share more of what our hospitals are experiencing. Dr. Melms?
Thank you, Secretary. I do want to provide some context about the pandemic and its effect on healthcare organizations. I am the Chief Medical Officer for Marshfield Clinic Health System, and we are a system that has 9 hospitals across primarily northern, western, and central Wisconsin. Our organization has faced challenges during this pandemic very comparable to other organizations, other healthcare organizations in the state. For context, last November, our inpatient numbers in our system, we had 158 inpatients at our peak. Mid-November, we started to see those numbers drop inexplicably. They continued to drop through the first part of 21. And by June and early July, we were seeing numbers that were in the single digits in our inpatient population, and we were thrilled. And then Delta happened. And since that time, we have seen steady increases in our inpatient census for COVID patients. Now, including over the past week in our organization, we've seen an increase of about 10% of our COVID patients. The vast majority of our hospitalized patients, I need to make this clear, the vast majority of our hospitalized patients are unvaccinated. One of the great tragedies of this pandemic is the number of nearly preventable deaths, nearly completely preventable deaths that we have throughout our state and in my personal experience within our healthcare organization. Greater than 90% of the COVID deaths in our facilities have been among the unvaccinated. We just went through a 4-week period here at our main hospital in Marshfield, where we had 35 of our patients die of COVID. In fact, the only reason that our COVID numbers haven't risen as fast as that they could have risen faster is because of the deaths from COVID within our facilities. But it's not just the patients with COVID that have been affected by this pandemic. COVID has severely affected our normal operations. We are a referral facility here in Marshfield, which means that we take referrals from all over the state and in fact beyond the state's borders, from smaller hospitals who need the level of care that we can provide to their patients when that level exceeds that hospital's ability to care for the patients. We are currently turning away over 100 referrals a week from hospitals, facilities that need our help. Space is tight in our facilities, but mostly we just don't have the staff to care for everyone who needs our help. As I tell my teams, we can always create more space, which we do, but we cannot create the people to care for our patients. We have discontinued all elective surgeries requiring an inpatient bed. In Marshfield, we converted an entire medical floor to an inpatient unit, and we doubled the beds in that unit. We converted our medical ICU into a COVID ICU, and we doubled the beds in that unit. We had to create a new ICU to take care of our other non-COVID ICU patients. We have moved outpatient staff to help on the inpatient side. We have looked for staff everywhere. We've taken them from the Department of Education, from our quality department, from our care retention department, from everywhere that we possibly can to take care of the demands on our staff. But it's not enough. It's not nearly enough. We have been hiring agency staff at higher numbers than ever before, and we still need more of those. The course and nature of this pandemic has been driven by the unvaccinated. And while I respect that vaccination is a personal choice, it is important that everyone understands that our healthcare organizations have been pushed to the breaking point, and it is quite possible that Omicron will push us beyond the breaking point. We will continue to do the best that we can, and I know I speak for all of the healthcare organizations in our state in doing that, but something's got to give. And the message that I have is to strongly encourage people to become vaccinated. If you've had your 2-shot series, please get the booster. We know that that helps to provide additional protection against not only Delta, but also against Omicron. And wear a mask. Wear a mask when you are indoors amongst people who are not members of your family. I have to say that I've grown weary of being in our local home improvement store and I'm the only one wearing a mask. This is an important mitigation strategy as we go forward, and many states have reinstituted masking requirements with the advent of Omicron. Also, one final thing, just so we're clear, you can get your influenza vaccine and your COVID vaccine at the same visit. So let there be no misunderstanding about that. Thank you for giving me the opportunity to speak, Secretary.
All right, thank you so much both for that. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you are able to do so, you can use *6 to mute and unmute your phone. We do need to wrap up on time today, so in the interest of time, to ensure everyone can ask a question, we ask you to limit yourself to just one. And we begin today with Heather Poltrock, WSAW. Heather.
All right, thank you. For people who are fully vaccinated and eligible for a booster but have chosen not to get it, can you talk about a timeline for when their protection will wane, or will there ever be a point where they would need to restart a vaccine series?
Dr. Westergaard, do you want to take that one?
Yeah, thank you. The best available evidence we have is that vaccine-induced immunity wanes at about 6 months. That's the rationale for the strong recommendation to get a booster dose 6 months after the primary series. So if someone has not yet done that, the recommendation is to go out as soon as possible and get the booster recommendation. Now, there's not a time for the second part of your question where we recommend restarting a multi-dose series. Right now, the best available evidence suggests that 3 doses is the highest level of protection that we need, with a small exception that for people who are moderately or severely immunosuppressed because of chemotherapy or autoimmune disease or other medical conditions may get 4, meaning a 3-dose primary series and then a booster 6 months later. So there's really no populations for any people now over 16 who are not recommended to get a booster at 6 months. So we strongly encourage everyone to do it.
Thank you for that. Let's go now to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thanks for holding this. I was wondering, given the lag time for the genomic sequencing, what percentage of cases would you estimate are currently Omicron in Wisconsin? Thank you.
So I'll start, and I'm sure Dr. Westergaard will want to add on. Right now, through lab partners all across the state, we are sequencing roughly 5% of the positive COVID-19 test results that are taken through PCR means and referred via laboratories to those labs that do sequencing. So as noted, we've detected 19 cases so far. We are continuing to look, and I'm sure that unfortunately we will continue to find more. I'm not aware that we have a good basis right now to estimate the sheer numbers of cases that are attributable to Omicron. There is no question that the Delta variant remains the dominant circulating variant in the state. But Dr. Westergaard, anything you want to add to that?
Yes, I agree. It's difficult to say that with any precision because of, number one, small sample size. We only have a small number of cases for this week and previous week, and as you mentioned, the lag. But everywhere that it's being looked at, where it is being detected, it's increasing rapidly, from single-digit percentages to some places in the 20 and 30% nationally and internationally. So we use the evidence that we have to the best of our ability. Our expectation is that it's going to be circulating at high levels very shortly if it's not already.
you for that. Let's go now to John Nicer, NBC 26.
Yes, my question is regarding the idea of reopening a field hospital. Is there any conversation about that, or is there an issue with staffing that's stopping that from happening at this point?
So the strategy that we are working on right now with hospitals and with long-term care partners all across our state is to expand capacity by adding staff in a more regional fashion. I think while we were very fortunate to have the field hospital and certainly did have numbers of patients need to use it last spring, what we're finding is that certainly patients prefer to receive care as close to home as possible. And as Dr. Melms noted, the issue really is staffing. It is less about brick and mortar sort of facilities that are needed. So by working with hospitals and long-term care providers, we're doing everything we can to add staff, again, in that kind of regional distribution so that we can increase both hospital capacity across our state as well as increasing long-term care capacity across our state.
Thank you for that. Let's go now to Brittany Schmidt, WBAY. Brittany.
Hi. So some doctors that I've talked to are calling this a tsunami, or others are referring to other terms as a Category 5 hurricane heading our way. Is Wisconsin at its breaking point? Hospitals at capacity, more infections each day, many counties at critical high risk for spread. So what is that tipping point, and when do we start having a conversation where does the government start to intervene again? You know, mandatory masking, people working from home, virtual school, lockdowns. Are those conversations happening?
I think I'd like to start with this, and then I'm sure Dr. Melms will have a perspective to add as well. I think one of the things that's really important for people to understand is that while there is no question that we are all very concerned about both the ongoing spread of the Delta variant as well as the advent of the Omicron variant, there are things we can be doing right now to change the course of this disease and to reduce the numbers of new cases. And so it's really important that people take the opportunity that we have before we get to that tipping point, before we get even further into that kind of crisis mode, to do everything that we can do as individuals. You heard Dr. Melms describe everything that Marshfield Clinic hospitals are doing and hospitals across our state are doing to make sure they can provide excellent care. The least we can all do is take the steps in our own lives, like getting vaccinated, getting boosters, wearing masks, keeping gatherings small, to support what our healthcare systems are doing to protect us.
I would agree with that, Secretary. The mitigation strategies that are offered, vaccination, masking in public indoor spaces, could take us a long way to mitigating the terrible effects of this pandemic. And I will say that as you are looking for terms to call this, Dr. Osterhold at the University of Minnesota just coined the phrase viral blizzard. And I think that might characterize this accurately.
Thank you for that. Let's go now to Alex Moe, WIS Business. Alex.
Hi, thanks for taking my question. With the Omicron variant now spreading in Wisconsin, does the state have any plans to set up mass booster clinics to get more people to get that booster dose? And can you explain why or why not? Thank you.
Yep, thanks for that question. We have over 1,300 vaccinators who participated in giving vaccinations in our state just last week, and there are a total of almost 2,000 people enrolled as vaccinators. So there are a great number of sites available for people to get, whether it's their primary COVID vaccine series or their booster dose. The best way to find a vaccine is through vaccines.gov or by calling 211. There are numbers of public clinics, if you will, that serve as that kind of mass vaccination opportunity that you're describing. And so again, really encourage everyone to go to vaccines.gov, call 211, and be persistent in finding yourself and members of your family a booster dose.
Thank you. Let's go now to Frank Zufall, Sawyer County Record. Frank. Frank with the Sawyer County Record, are you on the call? We heard you for just a moment. *6 will mute and unmute your phone. All right, why don't we move on to Aaron at FOX6. We'll try to get back to Frank. Let's go to Aaron at FOX6.
Hello, everyone. You know, this conversation is happening as we approach Christmas and the holidays and one of the busiest travel weeks of the year. What message do you really want to drive home to people who are going to be traveling this week and gathering with family over the weekend?
So one important part of that message is that we need everyone to be traveling safely and celebrating safely. So that includes knowing your COVID status before you travel. So get yourself tested if you have any symptoms or if you believe you've been exposed to someone with COVID-19. Get vaccinated, get your booster shot to help increase that level of protection. Certainly, we know that as people are traveling on airplanes and through other kinds of mass transit, masks are required. Please wear your mask. Please wear it over your nose and your mouth. Please use a well-fitting mask. We have some good guidance on masks available on the DHS website. And in terms of family gatherings, you know, this is very difficult for many of us. Lots of people postponed or canceled holiday gatherings last year. Everyone wants to see family and friends again. And I think the core message today is you can do that, but you need to do it safely. So keeping gatherings small, again, being aware of people who may be gathering with you who are immunocompromised or would be at greater risk of COVID-19, wearing masks indoors if that's comfortable for you with those more vulnerable family members, getting tested in advance if that's available and if you're feeling like that would be a safe strategy. So we all have to continue to make adjustments as much as none of us wants to in some of our sort of standard practices in order to have a happy and a safe holiday.
Thank you. Let's get the next question to Eric Gunn at the Wisconsin Examiner. Eric.
Thank you for taking my question. There was a press release this morning from the National Guard that mentioned that they were providing support at 4 state mental health facilities. Wanting to know why there's been a particular staff shortage at those locations. Is that only due to the pandemic or did it start later? And has there been a COVID outbreak that affects staff and residents at any of those locations? Thank you.
Yep, appreciate the question. So we have been fortunate to have Wisconsin National Guard provide some staff support at state mental health facilities, though we have been experiencing extremely high vacancy rates among, in particular, registered nurses and also certified nursing assistants and psychiatric care and residential care techs in those facilities. That is not directly due to the pandemic. It has been a challenge for many months, unfortunately, and so we are fortunate to be able to have our National Guard partners provide some ongoing support. With that said, we also are working with the Guard and with our own state facilities to continue to train National Guard volunteers to be qualified to serve as temporary nursing assistants in other facilities as well. So taking the opportunity that is presented by this very challenging moment to build the workforce that will be available in other parts of the state as well.
Thank you for that. Let's try to go back to Frank in Sawyer County. Frank, are you on the call now?
Yes, hi. Hi, can you hear me?
Yes, we can hear you. Go ahead.
Hello? Okay, yeah, I'm calling from northern Wisconsin, Hayward. And obviously we have a very, very large cross-country ski event here at the end of February that attracts going to attract 10 to 12,000 skiers, 35,000 participants, spectators. Last year, 2021, the event was scaled back greatly because of COVID concerns, and that was even before the presence of the Delta variant. And now we have the Omicron variant. As it stands right now, the American Burqa Binder is planning on having a Burqa Binder with the large crowds. I have talked to the officials there, and they said they're open to any advice from health officials. How do you feel about a large event that attracts not only national skiers, but international participants coming to northern Wisconsin in late February? Is that a concern for you?
Dr. Westergaard, maybe you'd like to speak to the consulting and the support that's available through our Bureau of Communicable Diseases for these kinds of events.
Sure, I think that's an important piece, is that we, local public health departments and our state public health department have consulted with a lot of organizations about infection control or infection prevention recommendations and are happy to do so. General principles for planning these kinds of events is that there are many tools and strategies that can be used to make them safer if they don't make the decision to scale back dramatically or cancel. And those include requiring vaccinations, requiring masks as a condition of participation, and then having the local community step up to implement and ensure that we adopt mitigation strategies that we are recommending for all communities. So these events are risky to be super spreader events, but there are many, many tools that we can implement to make them safer and enjoy what's great about Wisconsin. We just need to make sure that we do those and we do them well.
Thank you for that. Let's go now to Gretchen, WMTV in Madison. Gretchen.
Hi there. Yeah, Gretchen with NBC 15 in Madison. At this point, are you recommending that counties issue their own mask mandates?
I think the important message today is that wearing masks is very effective at preventing the spread of COVID-19. We know that we have an ongoing mask mandate here in Dane County. We know that there are employers and other settings across the state that are continuing to ask people to wear masks so that we can continue to stop the spread of COVID-19. So I think that whatever people can do to choose themselves to wear a mask, that is obviously a critical part of the message, and we all need to be really depending on one another to take those steps to stop the spread of this important and very challenging virus.
Thank you. Let's go now to David Wahlberg. David Wahlberg from the Wisconsin State Journal.
Yeah, thank you. 10 days or so ago, I'm losing track of time, you talked about requesting federal help with staffing, especially at ICUs, FEMA teams possibly coming. You also gave an update on how many staff had been placed at different Wisconsin facilities, hospitals, and nursing homes from the state, DHS. Can you give an update on both of those situations? When might the FEMA teams come, and how many staff at how many facilities?
You bet. So in terms of the staff that have been sourced through the staffing contracts, we are at just about 415 or so staff that have been placed in hospitals and long-term care facilities across our state. And they will typically be there for about 90 days. In terms of the ongoing dialogue with FEMA and the Department of Health and Human Services, we have had very productive discussions. We've had some targeted interviews to really gauge the availability of those federal resources and the way that they might best be deployed in our state. So we are continuing to make good progress and look forward to having more to say about that soon.
Thank you. Next question, Gabriella, Fox 11 in Green Bay. Gabriella. *6 will mute and unmute your phone. Gabriella at Fox 11.
Hello.
Hi.
Hi, can you hear me now?
Yes.
So along with that last question, you have 270 plus requests for FEMA workers. If you can't get enough to fulfill those requests, how else will the state help?
So just for clarity, we have hundreds of facilities that have made requests to us for support through the staffing contract, and we are working as fast as we can to fulfill as many of those requests as we can. One of the things we have done most recently is to add some additional vendors to that state staffing contract so that we have more options. The reality of it is, as Dr. Melms alluded to in his comments, the demand for healthcare services and healthcare workers, including long-term care workers, exceeds the supply right now. And so that is why we are continuing to make every adjustment and use every strategy that we can identify to both source and deploy more staff, to stretch the time and the availability of those staff as much as we can. And we really, really need help on the demand side. We need people to be getting vaccinated, getting booster shots, wearing their masks, and reducing the spread of COVID-19.
Thank you. Now to Will Cushman at PBS Wisconsin. Will.
Hi there, thank you. We're about, I guess, a little over a year now out from when the vaccines arrived in Wisconsin and people started getting vaccinated. And I believe Secretary Timberlake described the current moment as another kind of critical moment in the pandemic. I'm curious, this question is for any of you, how does the current moment compare to where you thought or hoped we would be at this point? And what does it suggest to you about the future of the pandemic going forward over the next several months or so? Thank you.
Yeah, I'll start and then certainly would welcome colleagues to join in. I think Dr. Melms laid out the case well. We similarly were very pleased to see the decline in cases over the summer, and even had brief thoughts of how we could start to wind down some of the emergency response that continues across state government to address this pandemic, and then Delta arrived. So on the one hand, I don't think any of us is surprised that there have been additional variants. On the other hand, I think what we're all experiencing is the bumping up against the limits of our ability to continue to identify resources and to continue to create that sense that there are things each person can do to help make this situation better. And that really is today's main message, is that we each have a role to play, and we are at a point where whatever you thought you were doing to help make COVID-19 better, we need everyone to be doing a little bit more. But Dr. Melms, how about from your perspective?
Yeah, thank you. A year ago, a little over a year ago, in fact, when we peaked, this was all very, very much of a big unknown. And as we saw the numbers drop, we thought they were going to drop, and that was going to be it. We were all hoping that the pandemic was going to end at some point in the near future. So I will speak for myself and say that we underestimated the potential contribution of variants of this virus. And we probably shouldn't have, because it is the nature of a virus to mutate, and the successful mutations become variants. And that's what we're facing with Omicron. It's what we faced with Delta. And it makes the future a little unclear.
I could add on to both of those comments. Regarding the question about vaccines in particular, I feel very proud, and I think we should all feel very proud of what we've accomplished with COVID-19 vaccinations. And we've gotten 60% of the entire state vaccinated so far, and 85% of people over 65 who are the highest risk of being hospitalized. And that's tremendous. And that's a testament to a lot of hard work for a lot of people and a lot of great choices by a lot of Wisconsin residents. But it's not been enough, as Dr. Melms said, and as he really nicely articulated, and we're really grateful for his sharing this perspective. It hasn't been enough, because what's happening in our hospitals now is that we are under tremendous strain. It's too infectious. It causes too many people to get sick and require hospitalization. So although our recommendations are really the same, we're really urging people to hear them differently. living in a situation where people are turned away from hospital transfers when they need higher levels of care at high numbers, 100 a week. That's not normal and it's not acceptable. And we need to use all the resources, both at our system level and our individual level, to try to turn the tide against this really dangerous situation. Our people who are working in hospitals are being asked to do extraordinary things, caring for people with insufficient resources, insufficient time, and dealing with burnout and mental health crises. So we need to ask all Wisconsinites to do extraordinary things. And that means if you've been someone who's decided to not get vaccinated to this point, please reconsider, please get vaccinated and get a booster dose for the sake of our collective public health. It's something that we need to ask everybody to do. And if you're someone who has decided or declined to wear a mask in public in the past, please hear this message differently, because we're in a different place. We're in a very dangerous place, and we need people to contribute in every way that they can to save the lives that we're in grave danger of not being able to save.
Thank you for that. Let's go now to Brittany at WAOW in Wausau.
Thank you. So we've talked a lot about getting COVID tested before gathering with families. So talk a little bit about those at-home rapid tests, their efficiency, but also can someone submit that to insurance like they can with a regular COVID test? Thank you.
Dr. Westergaard, do you want to speak to the overall use case for those tests?
Sure. There are a variety of at-home tests. In many cases, they are antigen detection tests, which are very similar to the antigen detection kits that are used in laboratories. So they work reasonably well, though not as reliable as PCR tests or the molecular tests. A general rule of thumb is at about 75% sensitivity. So they may miss up to 1 out of 4 cases when we've looked at our Wisconsin data. So that can be very, very useful though, because they are available over the counter and they give results quickly. So if someone has access to those tests and follows the instructions precisely and understands what the results mean and has resources to ask for advice depending on whether the test is positive or negative, we encourage people to use those tests. What we've heard from the federal government, and this is the part that I probably not prepared to answer about insurance, is that this is becoming a larger part of our strategy, and there may be policies in the future about insurance reimbursement that we may not be defined yet. But in general, if you have access to an at-home test kit, in these circumstances where you need an answer quickly, they are another useful resource that we encourage people to use.
And I'll pick up on the last part of Dr. Westergaard's answer just to say that part of the plan that President Biden announced in the last week or two that I imagine we will continue to hear more about is an intent on the federal government's part to make those at-home tests reimbursable through insurance. And so we certainly do expect more developments in that regard. Meanwhile, though, once again, finding locations for testing, whether PCR testing or in some cases antigen testing, the DHS website is a great place to start, as is calling 211.
Thank you for that. Next question to Denise Lockwood at Racine County I.
Good afternoon. My question is around the emergency room and how people are being boarded in hallways for sometimes several days waiting for beds. I'm questioning how those beds are being reported into the hospitalizations and also the quality of care that those people are receiving in a hallway.
I think we may have to follow up with you on how those patients would be counted in the hospitalization data. What I'll say generally, and then certainly would welcome my physician colleagues to add on here, we share that concern that patients who come into a hospital needing emergency care and are not able to immediately be transferred to an inpatient room if that is what they need, that is by definition not the care that any of us would want for ourselves or a family member or a loved one. It is a direct result of the capacity pressures that we are seeing in our hospitals from COVID-19 infections, which again are largely preventable. At least the serious illness and hospitalization is largely preventable through vaccination and through mask wearing. But I will certainly welcome my physician colleagues to add in.
Thank you, Secretary, and I will comment on this. And we could, and we do board patients in our emergency rooms in all of our facilities. We pride ourselves in being able to do it for less than a day, generally, but we do board them, and we feel that we provide the best quality care during that time that we can. We could probably prevent this by closing our ERs to ambulance traffic. But I have directed all 9 of our hospitals that that is not an option. All of our hospitals are open to ambulance traffic. I will speak for all of the healthcare organizations in the state and say that everyone understands their responsibilities and everyone is doing what they can. And part of that is taking care of people wherever we can. And that means that many patients will be boarded in ERs before they can be assigned to inpatient beds.
Thank you for that, both of you. Let's go now to Casey Nelson, WTAQ in Green Bay. Casey.
Hi, thanks for taking the call. This is, I think, more directed for Dr. Melms. You know, Assembly Speaker Robin Vos is arguing, you know, workplace vaccine mandates are one of the factors behind a shortage of having healthcare workers, like you mentioned earlier. Just wondering what maybe your take is on that, and maybe some ways that you're working on finding, you know, more nurses and things like that. Thank you.
Well, I will answer that question, and I appreciate the question. We do have a vaccine mandate in our organization, but I will comment that the vast majority of our employees that elected not to become vaccinated have been granted exemptions to the vaccine for various reasons, all of which that we reviewed carefully. We really only lost in our entire organization, and we have over 12,000 employees. We lost less than 100 employees because of the vaccine mandate. But one thing that did happen with the vaccine mandate is that many of our hesitant employees, thousands of our hesitant employees, did elect to get vaccinated. So it accomplished what it needed to do.
Thank you for that. Next question to Molly Beck, Milwaukee Journal-Sentinel. Molly.
Hi, thanks for having this call. I was wondering if there are discussions or plans to boost the amount of money that the agency is spending on ad campaigns to encourage vaccinations or encourage mask wearing or encourage other kinds of behaviors that would reduce the spread of COVID-19, since we are at the point we're at right now. Thank you.
Yep, thank you. We do have some ad campaigns already in the market, and we have more that are coming, really focused on making sure that we can keep our kids safe and healthy and in school. I think all of us know that keeping schools open and having kids have the opportunity for in-person learning as much as possible is really critical. And obviously that too is challenged by both Delta as well as Omicron. In addition, you know, we're obviously looking at social media and other forms of outreach through things like the latest round of community-based organization grants that we just distributed. A lot of those resources are being used for outreach. So we think it's important to continue to promote consistent information through a wide variety of channels, and certainly we will continue to do that.
Thank you. We now go to Allison at Spectrum News. Allison.
For those unvaccinated and wanting to get vaccinated, is it too late to get that protection for holiday gatherings? Thank you.
Dr. Westergaard, do you want to speak to that?
It's too late to get what we expect to be full protection from the vaccination series. Fully vaccinated generally means receiving 2 doses of an mRNA vaccine and then waiting 2 weeks. So the full protection does take more time, but I would certainly not recommend anyone decide against getting vaccinated at this moment because of that for the holidays. Anyone who's vaccinated is going to be better off than someone who's not, because the virus is going to be here for a while. But yes, it does. Full vaccination takes a long time, and it gets better over time. And booster doses then 6 months later provide even better protection. So if you've not started the vaccination series, do it as soon as possible so we can get going on and getting the immune system protected.
Thank you for that. Next question to Emily Ness, WKOW. Emily.
Hi, everyone. Thanks for all of the information today. Really appreciate it. Of the people that are hospitalized, are you guys able to provide any insight on how many of those are children?
We do have some data on our website that speaks to that. What I can tell you overall is that since the beginning of the pandemic, we have had more than 2,000 people under the age of 20. So depending on how you define children, 2,000 people under the age of 20 who have been hospitalized. Happy to follow up with you on whatever the most accurate point in time information is that we do have. But I think it's important for people to understand, for parents and caregivers to understand that COVID creates risk for children. It creates risk certainly of complications. Children are being found to experience long COVID symptoms that really keep them out of school and other activities for long periods of time. Kids 5 years old and up are now eligible to be vaccinated. Parents with questions should absolutely consult with their child's pediatrician and caregiver and make a plan to get their children vaccinated.
Thank you. We go now to Alejandro Riano. Alejandro, are you on the call? *6 will mute and unmute your phone. All right, we'll just give him a moment and we'll move on to Melissa at CBS 58. CBS 58, are you on the call?
Hello. My question is, you said hospitals are likely going to be over their breaking point in the coming weeks. Does that mean elective surgeries will likely be canceled or postponed, kind of like we saw at the beginning of the pandemic?
What I think is important for people to understand is that our hospitals across our state are stretching every resource that they can as far as they can in order to make sure that they can provide good care for everyone who needs it. So it is the case today in some places across our state that elective procedures, again, with careful physician review, are being delayed. Dr. Melms can certainly speak more to what that decision-making looks like. And I think it's also important for people to understand that we also want people to continue to seek care that they need when they need it. So by doing what we can do to keep ourselves safe from COVID-19 and the flu, we will extend hospital capacity for the other events of life, including ongoing care that people continue to need. But Dr. Melms, what does this look like in your neck of the woods?
Thank you. And the term elective surgery, it always kind of makes me bristle a little bit because it's not elective for the person who needs it. But we do know that there are surgical cases that can safely be delayed. And for those cases, many organizations, including ours, have had to limit those right now, particularly during the month of December, as the nursing staff and other staff members are deployed to take care of other individuals. So it is a balancing act. But I do want to point out one thing that the Secretary just commented on that's really important. And that is, if we go back to the beginning of the pandemic, what we did is we shut everything down. because we just didn't know. We didn't have enough PPE. We didn't know what to expect. So we shut down ambulatory operations, which did cause significant delays in routine care for chronic medical conditions, and also screening procedures for cancer, mammograms, colonoscopies, those kind of things. We have done everything we can to maintain ambulatory operations to make sure that people do get the care that they need for those conditions and for routine cancer screenings.
Thank you for that. And our final question, we go back to Alejandro Riano. Alejandro, are you on the call? And I know that he is having issues with calling in and did email a question, so I'm actually going to ask it for him. What are the populations that are more vulnerable with the new data coming out about infections?
Dr. Westergaard, do you want to take that one?
Sure. One, to date, all of the variants and in every place where we've looked, the single biggest marker of vulnerability to severe COVID-19 disease, hospitalization, and death is age. You know, that really jumps out. It's strikingly higher risk in people who are elderly, about 60, 70, 80, tend to have our highest risk. Beyond that, pre-existing medical conditions, and there's a substantial list of those which we can find increases someone's risk of having severe disease. Whether those things hold true with the Omicron variant is too early to know for certain. There's a lot of studies being done of whether the severity and other clinical manifestations are different in any way. But I think most of us expect that they're, being unvaccinated, number one, being of older age, are going to continue to be the risk of severe disease. On top of that, with COVID-19, as many health conditions, we see racial and ethnic disparities in the likelihood of severe disease. And this is something that we have to work on over time, as we do in our healthcare systems and our public health and our community work. People in Wisconsin who are Black, Indigenous, Latino are generally at higher risk of disease across a wide range of health conditions, and COVID has been no different.
All right, thank you so much for that. And with that, we will wrap up today's briefing. Thank you so much, Secretary-Designate Timberlake, Dr. Westergaard, and Dr. Melms, and of course, all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance, and be safe and have a great afternoon.